Hi, my name is Casey, and I'm an occupational therapist student at Kaiser University. Today, I will be describing or explaining my intervention activity that I have chosen in order to target a specific goal that I created for Temple Grandin. In the movie, we see that she has sensory deficits. She will not receive hugs from her mother. And this happens a lot in the autistic population. I see a lot of my pediatric patients who do not enjoy sensory input from individuals specifically. So this goal says client will decrease sensitivity by 50% by the end of 6 months to be able to engage in work and school activities appropriately. We know that this sensory deficit, when not addressed, becomes a problem area in the school environment. There's a lot of events and just social interaction in general where the patient or the client needs to receive that input from other individuals to be able to socially interact properly. So definitely this is an activity that I would like to work on if I had Temple Grandin as a patient. And in this activity, it says here that I can use household items, but I'm taking more of a behavioral approach to it. And so it's more like a intervention that I can apply, or an activity or strategy that I can apply in every session. And it says, or it consists of being able to give that sensory input from the therapist, myself, or a caregiver every time that Temple would get happy or excited. We're going to take emotions into consideration and we're going to take advantage of them. So every time the client will get happy or excited, or she's simply happy because she achieved something, a goal, anything, we're just going to take take advantage of the emotions, and we will give a handshake whenever we see each other. We will give a pat in the back every single time Temple does something good, or accomplishes any activity or task. And then also fist bumps. So we would get any type of input into that session in order to slowly grade up the activity. And grading down this activity would be starting off this way: a pat in the back, a fist bump, any little type of touch to the body. And to grade it up, we would obviously provide more input. So an actual hug, that would be the ultimate goal. So we would slowly grade up this activity as time progresses, and as Temple can accept more sensory input. We know that she already accepts it from the machine she had built, probably a weighted blanket. Any of those deep pressure techniques can already help her, as in the movie it did help her. So now it would be getting the input from an individual. And so my activity, this intervention activity, does target performance skills. Mainly for performance skills, it would be social interaction. Motor skills, not really. Process skills, no. It would definitely be social interaction skills, targeting in the performance area. For client factors, the values, beliefs, and spirituality section, I believe, is targeted with my activity or intervention, as she values the help she's getting, the beliefs that she can tolerate. She's gonna definitely believe in herself more when she tolerates a fist bump, a pat in the back. So definitely the beliefs part is the main one targeted in the client factor area. And then we have occupations. Occupations, this is going to target all occupations, because we receive sensory input in every occupation we do. We receive sensory input. So mainly leisure and social participation will be definitely targeted with this sensory activity that I've created. And as I said before, to grade up, you increase the input, so a hug. And to grade down, it's more like a pat on the back, a fist bump. So these are the areas targeted in the occupational therapy OTPF domain. And yeah, this is my activity. This activity can be definitely completed in every session, since it's more like a strategy or a technique. And so this is my activity, this is my goal, and the areas targeted of the domain. Thank you for listening to my video today.